Now let's talk about locations. Now the locations is a big giveaway, and this is why you have to know all that anatomy, especially your bones before, and including your anatomical landmarks. Now let's look at these muscles right here, and let me and try to look at this list and let me see if you notice a pattern going on here. So occipitofrontalis, and this is also called the epicranius. They are one and the same muscle. Sometimes you see epicranius. I think your lab book might call it epicranius. Know that the occipitofrontalis and the epicranius are this one and the same. And actually, if you're using the Caput and Elson's anatomy coloring book, it does list a separate listing for frontalis and occipitalis. But again, most anatomy sources refer to it as the same thing, like a fused muscle, occipitofrontalis. Now, nasalis, zygomaticus minor, zygomaticus major, temporoparaetalis, temporalis, sternocleidomastoid, and omohyoid. What do these all have in common? Notice that they all have some terms that might sound familiar, but they all have a bone mentioned in their name, or sometimes multiple bones. So occipitofrontalis, hey, where's your occipital bone? Right here, right in the back. Frontal bone, over here. So hey, the occipitofrontalis runs from your occipital and to your frontal bone. And then you have your temporalis, and actually it's a deeper muscle. And then you have the temporal parietalis. This is more superficial. And again, hey, temporal bone and your parietal bones on the side, right? And then you have your nasalis, your nose, right? So nasal bone. And zygomaticus major, hey, your cheekbones, right? Your zygomaticus major, and you also have a zygomaticus minor. Now, omohyoid, I will cover real soon, but things that hyoid, that is a bone, that is part of your axial skeleton. And your sternocleidomastoid, so where's your sternum? Hey, that's central bone in your rib cage, right? Or central anterior bone. So the thing is that many muscles are named after bones, and again, I'm not asking you to memorize all and locate and know all your 206 bones just to give you more work. Again, it pays off. If you know your bones down solid, it saves you a lot of effort in kind of naming these muscles. And okay, so actually a little flashback. I think I did skip over this accidentally in the previous lecture. So there is an axial skeleton bone missing from here. And the thing is that it's missing, but it's also not labeled. But not only is it not labeled, it's also missing. The bone that's missing here, and that I forgot in my previous lecture, is the hyoid. So the special thing about the hyoid, remember that term articulation when two bones touch each other? The hyoid does not directly articulate with any other bone. It is the only bone that does not form a synovial joint with another bone. So this is, or actually doesn't form a joint with another bone. Thing is that when students hear that, they might think, okay, so the hyoid is just floating in the middle of nowhere. Well, no, the thing is that the hyoid is connected to all these muscles. So this is how it's kept into place. All these ligaments, all these muscles and tendons, this helps to keep the hyoid in place. And is it just something there to form an anchor? No, it's actually very important in the overall function of all these tongue muscles and muscles of the throat as well. So this is why the hyoid is very important. But again, it's special because it does not form a joint with another or articulation with another skeletal bone. And again, the hyoid is above this thing called, we haven't covered yet, but yeah, we have the trachea and the thyroid cartilage over here, or your Adam's apple. So here we have the length, or actually it's called the laryngeal prominence, your Adam's apple. But here's the larynx, again, your voice, aka your voice box, you might have heard that term. And this is the hyoid. So again, the hyoid is, even though it's not directly touching any other bone, it is anchored by all of these muscles, and it anchors all these muscles. So this is what keeps the hyoid in place, and it is part of your axial skeleton. But why do I point this out? Well, there's something called, we did talk to the omohyoid. So there's this term mylohyoid, and this is where I think they borrow it from Greek. Mylo means molar, but where are your molars? Hey, they're in the back of your mouth, right? The posterior. Notice that the mylohyoid is running from the posterior to the posterior of your jaw to your hyoid. Then you have the omohyoid. It has two bellies, and the omo is actually borrowed, again, I think from Greek. and omo means shoulder. So notice that it's going from the shoulder up to the hyoid. And then you have the Geniohyoid, which refers to the chin. I know this is where anatomists, like, I think maybe, why didn't they call the mental hyoid like the other term, like mental? I don't know why, but they went with the Greek word, I think. So they went with Geniohyoid means chin. But again, it's going from the chin to the hyoid. Stylohyoid. Hey, remember where that styloid process is in the back of the, yeah, on your temporal bone? So notice it's running all the way back there. The thyroid, the thyroid gland is over here. So again, look at it running from the hyoid or thyroid to the hyoid. And then the sternocleidomastoid, it's going from the hyoid to the sternum. So again, this is where all the, and it does get confusing because now it's adding more Greek terms in addition to the Latin terms we already learned. But what I'm getting at here is the hyoid is not just floating in the middle of nowhere in the middle of your throat. It is an important anchor to all these muscles. That's why it also has those little cornu, those little spikes. Very important for attaching all these muscles. Okay, so then now this is one of my favorite. You might have heard this abbreviation SCM, Sternocleidomastoid. So you already know one of the bones, right? So sterno sounds like sternum, right? So thing is that, what's cleido? So cleido is another term for clavicle. So they don't call it the sternocleidomastoid, unfortunately. They changed it a bit, and now they call it the sternocleidomastoid. So now we notice that it's not only on the sternum here, it's also on the clavicle. And this cleido term is not just by itself. It is found in certain other anatomical and medical terms, like cleidocranial dysplasia. Now, what we have here, or if you've watched Stranger Things, actually one of the character, I think, was it Dustin? Yeah. So his character, he mentions he has, I mean, he has it in real life, but he also has it, and his character has it too, right? So you may remember that little trick where he did his touch his shoulder together, or he has like a new set of teeth. So the thing is that cleidocranial, they're born without that clavicle. They're also missing, and remember, cranium refers to the skull. That's why they are often missing a lot of teeth, because they are missing some of the development in the skull and their teeth. Now, again, remember, I actually tried to record the Netflix, and they have some sort of copyright protection. I wish I could show the clip, but if you, I think it's like probably the first season, you may have remembered where he does this, but most of us can't do this, right? Most of us can't like do this, adduct our shoulders together toward the anterior like this. Like this is a meat. But again, is this boy able to do that? If you don't have that clavicle kind of holding you back, you're able to touch your shoulders together like that. So this is why it's called cleidocranial dysplasia. You don't have complete formation of some of your skull bones and also your clavicle over here. Okay, so let's go back to top hat. Let's go for and let's do a little review. I know, one of those infamous matching questions, but again, this one doesn't count for anything. So this is the most popular matches, and the most popular matches are correct. So yes, this is where those three muscles get their name from, those verbs. How about these? Another matching question. This might sound very familiar. Okay, let's see the responses, and most of you are correct. Again, this comes very handy when identifying, at least if you know these words, you should be able to identify the abdominal muscles just by how those fascicles, those little lines are arranged, those bundles of muscle fibers. Now, we talked about the sternum, we talked about the cleido meaning clavicle, but what about mastoid? So actually, let's talk about the next question. The mastoid process is located on the blank bone. Which bone would you find the mastoid process? And we did cover this in the axial skeleton lectures. Yeah, so which bone would you find the mastoid process on? Okay, let's see how everyone did. So most of you said temporal, and most of you are correct. It is on the temporal bone. So again, the temporal bones forming your temples, the more inferior side of your skull right there. So, well, not quite your mandible. So it isn't part of your mandible. It's part of your temporal bone. Now, why do I make a big deal about that? So sternocleidomastoid. Okay, so we know about the sternum. It does attach to the sternum here. It does attach to the clavicle, aka cleido. And mastoid process, remember, you can actually feel your mastoid processes, right? If you're watching at home, remember, you can feel the mastoid process, that bony part in the back of your ear. So notice where it's running. It's running all the way to that mastoid process on part of your temporal bone, and the mastoid process behind and posterior to your ear. So this is the cool thing. That's why I love the sternocleidomastoid. It's a huge, complicated name, and would be a good spelling bee word. But the thing is that if you know the root words, it literally tells you what it attaches to. It says it attaches to the sternum, the clavicle, and the mastoid process. So this is why it's a long word, but it really does pay off if you kind of know where these are located, and also these root words as well.